There's a gap with affordable health care, and one of the basic needs that's out there, particularly for folks with health issues, is prescriptions.
It was a huge thing for me for them to be able to help me with my medication, you know, me having high blood pressure and other problems. It was a big thing for me.
We've had patients that have stayed out of the hospital because the Religious Coalition has stepped up and paid for breathing medications, antibiotics, things along that sort.
I'm a medical oncologist. I'm a cancer specialist. And one of my patients was having more and more problem affording her medications. And I worked with social services and with our social workers to try to find some support to get the drugs for her free. And she always was evasive as to what she was doing. Until one night I was volunteering here on the Allen Linton Children, and she was my patient, and there she was, living here, because she was homeless, which she had never told me as her physician. Here's a woman who couldn't afford her apartment anymore because of the cost of her medications.
We're not always in a good place when we're unemployed and we have financial problems and we can't get our medication and we don't feel good. That is a big thing when you can go to a place and they are willing to help you, and even if they couldn't help themselves, they could refer you other places. It was a great blessing for me.
We do work very closely with the Religious Coalition in the voucher process to not only handle the immediate problem, but to make sure this person is going to be okay in the long run.